Assalamu alaikum. Hello everyone. Hello my dear students. How are you all? Welcome to another biology class. Today we are going to learn from chapter 7 and our topic is diseases of respiratory system. Okay. So we know that our lungs are an important organ of our respiratory system. And this organ can be damaged by the infection of bacteria, viruses, and the lungs may be affected due to air pollution, because of the presence of dust particles and chemicals. Even carelessness may cause complex diseases and infections. Okay, so complexities and death from common diseases can be decreased by learning about causes, symptoms, remedies, and prevention of common diseases of the respiratory system. So today we are going to learn about this common respiratory diseases and their causes, their symptoms, and their remedies, and also how to prevent them. Okay, so let's start with the most common respiratory disease, asthma. Asthma is one of the most common respiratory disease in our country. Asthma usually occurs due to overactive immune system. Okay, the hyperactivity of immunity can create asthma. The immunity system works more severely than necessary when a foreign body enters into lungs, and as a result, this disease can hamper our respiratory system. So, in many cases, asthma patients have a family history of the diseases. This one is not the genetic disease, but it can be the gene which are more sensitive to create asthma can be inherited from parents to offspring. It is not a contagious or microborne disease. Okay, so mm, what are the causes? Certain allergic foods like prawn, beef, hilsha. Actually, this thing varies from person to person. Every individual persons they have different uh, foods which can be allergic to that person. So that means that's why this reason of asthma vary from person to person. Smoke, dust, pollen, these things are also, when they enter into the lung with the inhaled air, can be the cause of asthma. Okay. In infants, common cold may cause symptoms of asthma, and seasonal variation can be found, mm, can be related with the asthma. Okay, symptoms of asthma increase in certain seasons around the year, especially in winter season or fall season. Okay, so these are the causes. And now let's talk about the symptoms of asthma. Like sudden increase in respiratory distress or suffocation, lip becomes pale blue, and the veins of the neck can be swelled, is then normal, and rapid deep breathing is attempted, and wheezing and whistling sound can be can come from the chest. Okay, as sufficient oxygen is not available in the alveolus, that results in the suffering of the patient. Okay, and sometimes white sputum may be discharged while coughing, and usually there is no fever. Uh, so fever is not the symptom of asthma. And during respiration, because fever is always really associated with the infection or inflammation. So asthma is not the uh, not associated with any kinds of viruses or bacteria. That's why no fever is usually found here with the asthma. So during respiration, the skin between two ribs is drawn inward. This one is also the another symptom of asthma, and patient becomes weak. Uh, Actually, this thing is these are the symptoms of asthma. So now Now let's talk about the remedies and how can we prevent this disease, respiratory disease, asthma. Remedy included by medical treatment, the disease cannot be fully cured. This is the unfortunate thing, but by proper medication may relieve the patient. Okay, so like avoid those food which creates respiratory distress, and this thing also varies from person to person. And live in clean, well ventilated, hygienic room, and you should avoid using or coming into contact with items like animal fur, artificial fibers, and that aggravate the symptoms of asthma or the things that can create allergy. Okay, so be careful and follow physician's advice. According to physician's advice, you should maintain your lifestyle and avoid smoking, tobacco, jorda, gul. These things are actually harmful mm, for our health. Not only it does not mean that these things only create asthma. These things also related with so many other diseases. So we should avoid smoking, tobacco, jorda, gul always. And serve the patient liquid diet during breathing problem. We should serve the patient with liquid diet, not the solid food. Okay. Now, so how can we prevent this asthma? Uh, we should live in hygienic atmosphere. We should avoid air pollution and things that may cause asthma in the workplace or house. Okay, and always carry inhalers and medicine and take them when necessary. And this one is for the patient who are already affected by asthma. Okay, so and even here is another information for the asthma patient, that it is to be noted that coax treat patients of this disease with high dose steroids which give instant relief from pain but causes long lasting negative health consequences. Okay, this type of treatment as well as coax should be avoided for the long term benefit. Now let's talk about the another respiratory disease, bronchitis. Bronchitis is more dangerous. Acute and chronic inflammation of the inner lining of any part of the bronchi or bronchial tube is called bronchitis. And this disease is caused by bacterial infection. Living in unhealthy conditions, inhaling dust, polluted air, smoking cigarettes and cold are one of the reason. These are the reason. These are the causes of bronchitis. Okay. Once attacked by bronchitis, there is a possibility of recurring attack. Usually infants and elderly persons are attacked by this disease. Smoking, unhealthy environment, pollution such as industrial dust, smoke are the main causes of this disease. Okay. So what are the symptoms? Mm, cough, chest pain, and breathing distress. When coughing, the patient feels severe chest pain, fever, and gradual weakness. Here, fever is the symptom of bronchitis, not the asthma, because bronchitis caused by the bacterial infections. There is no infection or inflammation occurs in asthma. That's why fever is not the symptom of asthma. And cannot eat solid food. Okay, in asthma, bronchitis, both of the cases, patient should avoid solid food. And here in bronchitis, patient cannot eat solid food. Sputum is discharged with cough, and if a flame or sputum comes out with cough for continuous 3 months, and if this disease attacks consecutively for 2 years, it is considered to be chronic bronchitis. Okay, chronic bronchitis, and in this case, proper treatment should be performed according to the physician's advice. Okay. So now the remedies and prevention. Remedies here: stop smoking, drinking alcohol, mm, use of tobacco, stop smoking, drinking alcohol, and use of tobacco. Um, mm, uh, should be the first remedy, and you should follow the physician's advice after mm, diagnosis of bronchitis, and keep the patient intolerable temperature and dry environment, not the moist temperature. Moist temperature, as a moist environment can create this disease, can raise this disease. Okay, and the condition, the symptoms, it can create more symptoms. Mm, mm, so keep the patient in tolerable temperature and dry environment, and feed nutritious liquid and hot food like hot milk, soup, these things. Okay, and full rest, this is mandatory. And prevention, how can we prevent? Prevention is better than cure. So bad habits like smoking, drinking alcohol, taking tobacco should be stopped completely. And also you should abstain from working in environment with dust or smoke, and even in moist environment you should avoid this moist environment, dusty environment, or the environment that can create so many smokes. And children or elderly people must not get cold. Okay, these are the these are the ways we can prevent bronchitis. Now another common, especially common for children and elderly people, is the pneumonia. Another respiratory disease. Pneumonia is a lung disease. Excessive cold may cause this disease. Getting affected by cold after measles and bronchitis may lead to pneumonia. Okay. So what are the causes of pneumonia? Pneumonia is caused by the pneumococcus bacteria. Okay, pneumonia may also be caused by other bacteria, viruses, or fungi, but pneumococcus is the most common, especially in our country. This disease may even occur when enzymes or saliva get into the trachea, okay, which is full of these bacteria. Now, what are the symptoms? The symptoms of pneumonia is deposition of mucus like liquid substances which produce cough. Okay, coughing, regular coughing, coughing and breathing distress can be created in case of pneumonia, and high fever, the chest pain, severe chest pain, and severe respiratory distress. Okay, at the last stage, wheezing sound in the chest, wheezing and whistling sound, and come from the lung. So now the remedies. Uh, Remedies include seeking timely advice from a physician and to follow the treatment given, serving hot and liquid nutritious diet to the patient, drinking plenty of water. And how can we prevent? Preventive measures are to be careful that the children and elders are not attacked with cold, living in well ventilated house, well ventilated and dry and not the moistened house. Keep the patient in tolerable temperature and dry environment, and we should avoid smoking. So now let's talk about another disease, tuberculosis. This one is different from our previous diseases. Tuberculosis is a well-known airborne infectious disease. Okay, but in some cases, people coming into contact with patients having skin affected by germs of tuberculosis or by taking infected cow's milk are more likely to develop this disease. Okay, so that means this one is kind of contagious. It can be transferred from one person to another, or from even from cow's milk to a person. It is to be noted that any man at any time may be affected by tuberculosis. Those who work hard, are weak, live in damp and unhealthy environments, suffer from malnutrition, or remain exposed to patients of um, tuberculosis easily become the victim of tuberculosis. Okay, they are more prone to tuberculosis. Most of us think tuberculosis is only a lung disease. No, this is wrong. This idea is not correct at all. Tuberculosis occurs at any organ of the body, such as it can be intestine, it can be bone. Okay, so not every person infected with tuberculosis become very sick. This is the good thing. And the symptoms are not exposed easily, but this one is not the good thing. That means the person who is already affected by tuberculosis, knowingly or unknowingly, if he's asymptomatic, he can unknowingly transfer his disease to another person. So this one is very alarming. And if anybody live in an unhealthy environment, the germ easily spread in the body. Okay, so when the germ destroy white blood corpuscles, the body become weak. Then the symptoms are exposed. Okay, so how can we diagnose? What are the causes of this tuberculosis? The disease is caused by Mycobacterium tuberculosis, okay, a type of bacterium that is responsible for the tuberculosis. Some other bacteria that belong to the Mycobacterium genus may also causes this tuberculosis. If anybody live in an unhealthy environment, then germ easily spread in the body. Okay, so how can we diagnosis tuberculosis? Uh, So these are the diagnosis process. This disease can be found out by sputum test, skin test like MT test, and histopathology or cytology, and chest X-ray. Okay, and the test also depends on the parts of the body affected by tuberculosis. Like if when lungs affected by tuberculosis, sample need to be taken from the respiratory tract. If anyone who is affected, if tuberculosis occurs in their bones or in their intestine, then sample should be taken from those organs, those places. Presently, the research is going on how to detect the disease confirmably by blood test. Okay. Nowadays, DNA-based test is also available in our country for the detection of tuberculosis germ in the sputum and other sample of patients. So now let's talk about the symptoms of tuberculosis. Weight loss, mm, rapid rapid weight loss, general weakness, and usually cough and cold continues more than 3 weeks, coughing sometimes with blood, evening sweat and rise of low fever. Temperature of the body does not increase so much, but always temperature remain high than normal. And chest pain, indigestion, abdominal diseases are also related with the tuberculosis. So now let's talk about the remedies. It includes continued treatment according to the advice of a physician. Treatment of the disease is a lengthy process. Treatment should continue until the complete cure. Okay, this one is a very important information. Physician's instructions must be followed strictly. Mm, Patients with tuberculosis should be isolated or sent to hospitals for complete cure. Keep the used belongings to the patient separately, because this one is a contagious. It can transfer from one person to another person. Patients cough and sputum should be buried in the soil. Proper treatment and adequate nutritious diet should be arranged. Without consulting the physician, medicine should not be stopped. Okay, so these are the remedies. And how can we prevent this tuberculosis? To get rid of this disease, all children should be vaccinated by BCG. Mm, the baby should be vaccinated within 1 year after birth. Though BCG vaccination gives children protection against deadly tuberculosis, but it doesn't mean that this thing remain effective for grown-ups. So administering vaccination in childhood is not a lifelong protection. Okay, so there are facilities of vaccination in different health centers of the country. So we should, everyone, grown-ups and also the children's, should immune us by taking vaccines. Now let's talk about the one of another dangerous respiratory disease, lung cancer. Among the various types of cancer, lung cancer is extensive and terribly prevalent. In our country, it is the leading causes of death of male cancer patients. Smoking is considered to be one of the main causes of lung cancer. Okay, lung cancer may be caused by air and environmental pollution, and mm, even coming in contact with pollutants like arsenic, chromium, nickel, solid metal, powder at workplace or home can create this lung cancer. Tuberculosis or any other respiratory disease or pneumonia also can be responsible for the lung cancer. Some kind of any kind of wound that afterwards which occurs in the respiratory systems can afterwards turns into cancer. So it is assumed that shortage of uh, mm, vegetables, okay, vegetables, roughage, many rough texture foods like vegetables in Bengali, which we call shak. These things mm, mm, can protect us from this type of diseases. Okay. Mm, so here, fibrous, we have rough is actually kind of fibrous material which is found in the vegetables. So we should consume more roughage, more vegetables, more fibrous in fibrous foods. Okay. Shortage of this fibrous food in diet can increase the possibility of the diseases. And what are the symptoms and signs? Symptoms, the sooner primary symptoms of lung cancer are diagnosed and given treatment, the more is the chance of living longer. Okay, at the primary step, symptoms of lung cancer are found long lasting, dry, irritating cough, chest pain, therefore hoarseness of voice, harshness of voice, gradual or day by day loss of weight, loss of appetite, asthma, frequent fever, repeatedly infected by pneumonia, bronchitis. That means respiratory diseases, chronic respiratory diseases. Okay, feel pain in bones, weakness, paralysis of any gland, jaundices. So these things are the symptoms of the lung cancer. And how can we diagnose this lung cancer? By X-ray of chest, CT scan, MRI, examining cough and sputum. Okay. So for final confirmation, actually cytopathology or histopathology tests are done. And these are the remedies and prevention. When the symptoms are found, we should consult the physician without any delay. After the disease is diagnosed, treatment should be taken as per the advice of the physician. And depending upon the necessity, um, use or apply radiotherapy, radio destroy the cancer cell may be helpful. Okay. Prevention. How can I prevent this dangerous disease? Like abstaining from smoking and drinking alcohol, not taking excessive fatty food, regular exercise, and making the habit of taking adequate amount of vegetables, especially the fibrous foods, can protect us from this disease. So this is all about human respiratory diseases and their causes, symptoms, and prevention. So I think that's all for today. Thank you all.